Hello and welcome. Today, we're diving deep into a fascinating yet potentially debilitating condition affecting the ear, adhesive otitis media. We'll explore what it is, what causes it, how it impacts your hearing, and the steps you can take to manage or even prevent it. Get ready to learn everything you need to know about this important ear health topic. So, what exactly triggers adhesive otitis media? The most common cause is chronic eustachian tube dysfunction. This tube, connecting the middle ear to the back of the throat, is crucial for equalizing pressure and draining fluids. When it fails to function properly, perhaps due to repeated ear infections, allergies, or even anatomical abnormalities, negative pressure builds up in the middle ear. This constant negative pressure sucks the eardrum inwards, leading to the adhesion or sticking of the eardrum to the structures within the middle ear. Let's delve into the pathophysiology. Imagine the eardrum, or tympanic membrane, constantly being pulled inward due to the persistent negative pressure. Over time, this pressure causes the eardrum to thin and adhere to the ossicles, the tiny bones responsible for transmitting sound. The most common ossicle affected is the malleus, or hammer. This adhesion restricts the movement of these bones, disrupting the normal sound conduction pathway. The result: hearing loss. Additionally, the chronic inflammation and poor ventilation can also lead to changes in the middle ear mucosa, further compounding the problem. While precise global figures are hard to come by, adhesive otitis media is considered a relatively common complication of chronic or recurrent otitis media, especially in populations with limited access to healthcare. Children, due to their shorter and more horizontal eustachian tubes, are particularly susceptible to ear infections and subsequently adhesive otitis media. However, it can also affect adults who have a history of chronic ear problems. How can you tell if you or a loved one has adhesive otitis media? The hallmark symptom is gradual hearing loss, which can range from mild to moderate. You might experience a feeling of fullness or pressure in the ear. Tinnitus, or ringing in the ears, is another common complaint. In some cases, you might also experience dizziness or vertigo, although this is less frequent. It's important to note that these symptoms can be subtle at first, so if you suspect any hearing problems, it's crucial to seek professional evaluation. Diagnosis of adhesive otitis media typically involves a comprehensive ear examination by an audiologist or ENT specialist. Otoscopy, using a specialized instrument called an otoscope, allows the doctor to visualize the eardrum and middle ear. Pneumatic otoscopy, which introduces a puff of air, can assess the eardrum's mobility. Audiometry, or hearing tests, quantifies the degree and type of hearing loss. Tympanometry measures the eardrum's movement and middle ear pressure, providing valuable information about eustachian tube function. In some cases, imaging studies like CT scans may be necessary to evaluate the middle ear structures in more detail. While not always formally classified into distinct types, adhesive otitis media can present with varying degrees of severity. Some individuals might have mild adhesions with minimal hearing loss, while others might experience severe adhesions with significant hearing impairment. The extent of ossicular involvement also varies, impacting the treatment approach. It's essential for your doctor to assess the specific characteristics of your condition to determine the most appropriate course of action. Treatment for adhesive otitis media aims to improve hearing and prevent further complications. Management options vary depending on the severity. For mild cases, observation with regular monitoring may be sufficient. However, if hearing loss is significant or progressive, surgical intervention is often necessary. Tympanoplasty, which involves reconstructing the eardrum, and ossiculoplasty, which involves repairing or replacing the ossicles, are common surgical procedures. In some cases, a ventilation tube, or tympanostomy tube, might be inserted to improve eustachian tube function and prevent negative pressure buildup. Hearing aids can also be used to amplify sound and improve hearing. Preventing adhesive otitis media primarily involves addressing the underlying causes of eustachian tube dysfunction and recurrent ear infections. Prompt and appropriate treatment of ear infections with antibiotics, when necessary, is crucial. Managing allergies with antihistamines or other medications can also help. Avoidance of smoke and other environmental irritants can reduce the risk of eustachian tube dysfunction. Good hygiene practices, such as frequent hand washing, can help prevent the spread of respiratory infections that can lead to ear problems. The prognosis for adhesive otitis media varies depending on the severity of the condition and the effectiveness of treatment. With prompt diagnosis and appropriate management, many individuals can experience significant improvement in hearing. Surgical interventions often yield good results, particularly when performed by experienced surgeons. However, recurrence is possible, especially if the underlying causes of eustachian tube dysfunction are not addressed. Ongoing research is focused on developing new and improved surgical techniques, as well as strategies for preventing and managing eustachian tube dysfunction. Some recent studies have explored the use of minimally invasive surgical approaches and novel biomaterials for ossicular reconstruction, offering hope for even better outcomes in the future.